Welcome to Symptoms and Side Eyes, where two doctors, one dermatologist, one lifestyle and obesity medicine specialist, join forces to debunk trendy medical myths, educate on all things skin, hair, nail, and wellness related, and provide a little humor and side eye at the same time.
All right, y'all, let me ask you something. How many of you have been doing everything you feel like right, but your body's just not doing what it's supposed to? You're trying everything to lose weight, but you can't. Your hormones feel like they're out of whack. Your hair is going crazy, and everything is just off.
If you just said, yes, girl, that's me, then this episode in this podcast is for you.
Yes, ma'am. Welcome to the very first episode of Symptoms and Side Eyes, the podcast where two doctor friends break down the real stuff happening to your body and give a little side eye to whatever TikTok told you to do about it.
Exactly. So I'm Dr. Lauren Payne. I'm a board-certified dermatologist and founder of Flourish Dermatology and Aesthetics here in New Orleans, Louisiana, and one half of this beautiful doctor power duo.
That's right. And I am Dr. Deniece Johnson, double board certified in internal medicine and obesity medicine, founder of Lifestyle Care in Atlanta, Georgia, and your favorite neighborhood doctor who's going to tell you the truth about your hormones, your weight, and why you're tired all the time.
Absolutely. So Denise and I go way back, over 17 years. So we met at Georgia State. We were both getting masters in neurobiology. And then lo and behold, first day of med school at Morehouse School of Medicine, who do I see to my left? None other than the Dr. Deniece Johnson. And now we're supporting each other through building our businesses. This podcast is long overdue.
We started Symptoms and Side Eyes because no matter what you come in for, whether it's stress, sleep, skin, weight, it's all connected. And we want you to know that you're not crazy and you're definitely not alone.
Exactly. So your acne isn't just, oh, I have bad skin, or your weight gain isn't just a lack of willpower. Your hair loss isn't always just genetics. There's usually an underlying reason, and we're here to help you find out what those reasons are. And let's be honest, Google is not a doctor, neither is ChatGPT or TikTok.
But we are. That's right. All right. So the core goals of our podcast, we just want to let you guys know where we're going with this, right? So number one, we want to educate you. We want to provide accurate evidence-based information about medical things that affect your skin, weight, metabolism, hormones, lifestyle, all that stuff. Information you can trust.
Absolutely. We also want to be able to relate to our audience, right? So we want to make sure that you can connect with us. We want to connect medical insights to real life situations that you actually encounter, like seasonal changes, diet, stress, self-care, all of the above.
Yes, and we definitely want to empower you by offering this practical and actionable tips, for your health and beauty routines. And that way, you can make decisions on what you believe and how to fit it into your busy schedule.
Absolutely. We also want to entertain a little bit. So we want to keep the conversation light and humorous. We both like to laugh and be funny. We want to make sure that's engaging, but also still making sure that you understand that we are credible resources and we're professional.
That's right. And most important, because we are professional and incredible resources, we're going to debunk all these myths and misinformation that's out here on the internet. So you can have confidence in your choices and know that you have a go-to place for real information.
Because there's so much misinformation out there and people are loud and wrong. So that's what we're here for. So today we're going to talk about the side chick that is not on your calendar but still running your entire life. So if your skin is a hot mess, if your waistline is starting to creep up a little bit, your energy has been awful recently, or your sleep kind of magically disappeared out of nowhere, yeah, we're talking to you.
That's right. And we're not just going to say stress is bad, right? We're going to talk about the actual chemical changes that are happening in your body, to your hormones, to your weight, to your skin, especially to let you know that sometimes these things are happening before you can even realize it on the outside.
Absolutely. That is so true. We're also going to give you real orders, real recommendations, not just the old adage of, oh, you just need to relax a little more, de-stress a little bit, but actual strategies you can implement into your daily routine that actually will work.
That's right. And stick around because we're going to share the specific signs that stress is no longer a guest and has moved in permanently to your body.
Absolutely. So, Dr. Deniece, let's kind of dive in with you first.
Mhm.
So, if someone is dealing with stress, is there a particular molecule or hormone in the body that tends to be the culprit for kind of secondary changes that can happen secondary to stress?
Yes, yes, yes. So our stress hormone, when we think stress, it's cortisol. Okay. That one is not just a TikTok buzzword. It is a real thing. And it is your body's number one, resource for stress. So cortisol is a hormone. Hormones are little messengers secreted from one part of the body that go to the other parts of the body. And cortisol comes from your adrenal glands, which sit right above your kidneys. And typically they follow a circadian rhythm, or they're high during the day and then they kind of come down and then they go up. So when you have normal amounts of stress, right, you get this quick release of cortisol. Everything's great. You got the strength of 10 men. Your energy is mobilized. And, think of that mom lifting the truck off of a baby. So these are quick acting, beneficial and reversible changes. And anything can trigger your cortisol: stress, lack of sleep, lack of feeling of control, work, caregiver loads, cognitive loads, surgery. Really, anything and everything can trigger you to have stress. And that's where we start to see the problems, right? Because stress is supposed to be this short thing, triggered, then goes away. But we get into something called chronic stress. This is the persistent excess of cortisol with any lack of recovery time. And that's when you get into that chronic stress, is what we're talking about.
Like, those are all good points. So, what are the effects of kind of chronic stress, maybe? And how long does it take for you to kind of start seeing those effects?
So, like we said, stress is something that you need, right? Cortisol, signals the other parts of your body. But when it's always in overdrive, then we start to get problems, right? So, the earliest signs of chronic stress are sleep disturbances and mood imbalances. All that anxiety, all that fatigue, like I'm so, so tired, but I still can't sleep, right? Or I'm anxious, or I'm snapping at people. All of those are small signs that your stress levels are ramping up above the normal levels. As that continued to build and we get into months of this chronic stress, now we're getting into the increased blood pressure, infections, chronic inflammation. All these things can have serious effect on the rest of your body because, like I said, hormones go other places. So one thing that happens a lot is you start to get that belly fat. That's because your cortisol is stimulating that visceral fat, and you're developing insulin resistance from all this, stress that you have around. It can go in your brain and it can cause depression, anxiety, memory problems. It also acts in your gut. Some people have irritable bowel syndrome or leaky gut syndrome where they get upset and they have diarrhea, or they get constipation, that kind of things. And then as you go on and on and on, well, now you're at risk for heart disease, type 2 diabetes, metabolic syndrome, and clogged arteries all over. That's where the strokes and all that stuff come in. So chronic stress, yes, it's bad in our everyday life, but if you continue, it's going to be bad for your whole life and could lead to early death.
Yeah, those are all good points and kind of scary, but important to
Yeah,
know, right? I think if you don't know what can happen with long-term chronic stress, then you don't learn until you have a stroke or have a heart attack, and at that point, it may be too late. So it's good to be
exactly.
informed early on. So thank you for
Right.
providing that
So what
information as
about
well.
from the hair and nail and skin perspective? Where do you see chronic stress coming out in those areas?
Yeah, so same thing in terms of acute and chronic, right? So a lot of times you'll see people get stress-induced acne, especially a lot of teenagers, like or college kids, right before finals time, things just kind of start popping up because they're stressed out. Definitely be triggered by stress and psoriasis as well. Hair shedding for sure is a
Yeah.
chronic, issue a lot of times associated with stress.
Oh yeah.
Sometimes it's not just the skincare or the hair care products, it's actually the stress that's the underlying issue. And so
Right.
a lot of times people will try to find all these products, right? Like, let me just buy all the shampoos, all the cleansers, all the serums to get my issue under control. And that's not the problem. The problem is the actual stress that's causing the issue. So no matter how much you spend on products,
Right.
if your stress is still a problem causing that issue, things are not going to get better. So
I
that's
think
it's
that's
important
so
to know.
important. Yeah, I think that's so important because, like you said, they know that something's going on, right? But they're trying to buy products and trying to do all these things. And I find the same thing with my weight loss patients. I had a patient, she came to me from a different practice because she wasn't getting the results or the care that she wanted, but her weight loss is stalled and she just wasn't doing that good. And when we dived in, it was really, the stress that she knew was there, but kind of wasn't dealing with. So she didn't really know exactly what it was causing to her. But once we got even just identifying the stress helped and she could, move forward in that way. So chronic stress can be the root cause and you can't diet or out exercise your stress. It's going to be affecting, all of your systems from the inside out.
So let's talk about these. So, what are some of the signs that you're under chronic stress? You kind of mentioned a couple of things earlier, but more kind of subtle signs potentially that people may be having now and aren't realizing that could be kind of secondary to this chronic stress they're dealing with.
Yes. So, as an internist, of course, one thing I want to help our listeners do is, correlate, the inside with the outside, right? So, I talked about how hormones go to different parts of the body and how it can affect those different parts of the body. So, that also kind of leads to the stresses that you're having, right? So, you get that 3 p.m. snacky feeling because your cortisol is increasing your ghrelin in your brain, which is making your gut hungry. Have sleep issues. A classic sign of stress and anxiety is waking up between 2 and 4 a.m. If you're consistently waking up at that time, you're probably super stressed out. And this comes from cortisol disrupting your melatonin and adrenal rhythm that you're supposed to have and, giving you fatigue. Like I said, the GI issues, the bowel habits change because now your stress levels and your cortisol have changed your inflammation. You get that belly fat. You can get leaky gut syndrome. Inflammation is all through your body, and it can't go just one place. Mood swings are a good example. That's your cortisol and adrenaline, your serotonin, all your messengers that control your mood. And then over drinking. Watch yourself for this one because it's a sneaky one. And suddenly you're having a drink every day. You only drink on the weekends, and now you're drinking more often, right? You're trying to calm down all that stress. But it's really important to, stop and acknowledge, hey, I'm stressed out. Yeah.
Absolutely. Absolutely.
Yeah. Do you see any changes in hair and nails? Ooh, and I wanted to ask for my own self. Can gray
Okay.
hair be a sign of stress?
Okay. Okay. So we'll start with the other general and then kind of go into your specific question. So, yes.
Mm-hmm.
So there's something called telogen effluvium. So when it comes to hair, let's talk about this. There's something called telogen effluvium. So the
Okay.
classic kind of example is woman has a baby and everything is great and she's having this wonderful euphoric feeling, and then 2 or 3 months later she's like, I love my baby, like what is happening with my hair though? And so what happens is there's this thing called telogen effluvium. So when you're having a
Yeah.
baby, it's a positive stress, but it is a stressful event on your body. And so it
Yeah.
causes hairs that typically are trying to grow, it causes them to go prematurely from their growing phase to their shedding phase. And so usually there's a 2 to 3 month delay, but you'll notice all of these hairs that kind of were stressed and went from growing to shedding will now start actually shedding. You'll actually start seeing the shedding. And so some women will
Mhm.
have clumps full of hair coming out 3 months after they had the baby and start to freak out, rightfully so, because they're like, wait, but I'm feeling great. Like I'm feeling positive. I have my baby. Life is great. So why is my hair coming out? And that's exactly what it is. The good thing is usually 90% of the time it will stop at some point, maybe 3 to 6 months, and it would be reversed. You kind of go back to what your baseline was, but it can kind of feel right if you're like, what is going on? I feel great. I'm eating great. Like something is a very natural process to happen. We do usually recommend though, if all of a sudden this is happening, you can always get some blood work as well, just to make sure no underlying issue
Mhm.
is causing, the hair thinning. So checking your iron, and ferritin, checking your thyroid, checking your vitamin D, just to rule out other
Mhm.
underlying causes. Because yes, you may have telogen effluvium, but you also can have a secondary nutritional imbalance or vitamin deficiency, and
Yeah.
you don't want to miss them too, right?
Yeah.
And then for patients who do have this, a lot of times we do recommend supplements, potentially prenatal vitamins, Nutrafol, which is a hair supplement. I think they do have one for postpartum women as well now. So kind of simple things like that. Also, scalp massages that can be helpful to kind of increase the blood circulation to the scalp. And then minoxidil is good. Minoxidil is not usually. I wouldn't recommend it while you're pregnant or breastfeeding, but kind of
Okay.
longer term, that also helps to increase the blood vessels, blood flow near the hair vessels. So I think that's totally fine. The biotin that you see in the hair, skin, and nails, do not do that. It does absolutely nothing for the hair by itself.
Okay, one more
and then
time on that, because I get this question so often. So you said no biotin, prenatal
no
vitamin,
biotin,
and
no
Nutrafol.
biotin,
Okay.
no biotin,
Okay.
no biotin, no biotin.
Mhm.
So once again, it doesn't do anything for the hair by itself. It can actually kind of mess up some of your test results. So specifically your thyroid. If you're on biotin and then go get your thyroid checked, sometimes it can be falsely elevated. So you want to be mindful of that. And it sometimes can cause acne in some patients too. So be mindful. Biotin, unless you're really trying to grow your nails, like there's really no purpose in taking that as a supplement by itself. And then back to your question about gray hair and stress. That is a thing, right? So it's not a myth.
Mhm.
Certain things can cause what we call oxidative stress. And so that can actually prematurely kind of make a hair follicle go from a darker color to gray. That is a thing. I have multiple gray hairs at this point in life. There is partially, it is partially genetic too. So sometimes you are born with hair follicles that are more susceptible to stress. And then all it takes is a trigger for those hairs that are already like, hey, I'm ready to go. And then the stress just causes it to change. You said you only have 2 or 3. That's nice. I only have 2 or 3 today because I plucked all the other 25 out yesterday. So that is just that is just a thing. But that is a real thing.
Okay. That's awesome. And so, yeah, y'all make sure y'all listening, because there will be a time when we have Dr. Payne do a whole episode on hair and all that stuff, because I know those are super hot topics. Super, super hot. Okay. So, but before we go any further, talking, all fun and games, the right things to take, but I just want to also re-emphasize the fact that you didn't say, and what I didn't say, is go get your cortisol labs checked. Okay. So Dr. Payne listed a bunch of labs, TSH, vitamin D, B12, all those things are good to check, but cortisol levels are not something that we typically check. Okay. If I think you have Cushing's disease or some kind of adrenal insufficiency, then I'm going to test you in those ways. But cortisol is actually a saliva test. Okay. So don't let anyone take your money and take your blood and say they're testing your cortisol. It doesn't work. Okay. And you can get a hair strand test for your cortisol too. So there are some tests that we can do to test your stress, but they are super, complicated, like measuring your HRV and scales and pupil diameter and things like that. So a good physician is not going to really do that. Okay. So every time a doctor tells you no, it's not, it's not right. But in this case, we cannot test your stress levels. Okay. You tell me you're stressed, I believe you, and we're going to figure it out. Okay.
And that's important, right? I think in this age, everyone wants a test to tell them what's going on. And unfortunately, sometimes there are no actual reliable tests to
Right.
tell you specifically what's going on, like you said, as it comes to stress. And so that's why it's also important for this podcast and for Dr. Deniece explaining some of those signs, because you honestly are your own best advocate. And so you know your body the best. And so picking up on these little subtle clues could potentially help save your life. And definitely identify that you are stressed or these stressful situations so you can adjust and modify as necessary. That's important. And then just speaking to, getting the relevant labs that are necessary that your doctor recommends, that your credible doctor recommends.
Yeah. So, just as an aside, pretty much B12, vitamin D, TSH, CBC, and Chem. All right. Those are your basic labs. Those will get you most everything that you need. All this fancy stuff is a lot of cha-ching, okay? And it's not always necessary.
That is true. We can have a whole other podcast episode about that, and we probably will. So
Yes.
stay tuned.
And I got lots of side eyes to give out, girl.
Okay, so let's dive in real quick to kind of some personal stories. So is there anything that you've experienced where you're like, oh, I think I'm a little stressed, like something that you saw or noticed and you're like, maybe there's some stress coming in.
Yeah, I mean, one for me was gray hairs, right? Like COVID, I knew I was going crazy, but, for me, I've been a very low stress person my entire life. I remember in college, somebody asked me what stress was. And I was like, I don't know. Like, what is that? Like,
She would like that in message too. Let me tell you. We are total opposites. So I was the one like freaking out, and she was like, everything is great. Everything is fine.
Right. And so it was, for me, it was really shocking because, after I started working, for the first couple years, boy, you couldn't tell me nothing. I was in love with my job. Boy, I was like, give me more, give me extra hours. I just want to work. But then, something changed and I found myself, I found gray hairs every once in a while. I found myself gaining weight. I found myself doing all these things and I figured it out like, girl, you are burnt out. And I think the good thing was that, it took me a long time to realize it. Probably, I thought about quitting my job for at least 5 years. And I think, in the last 2, 3, I was like, okay, this got to get done now. So, but once I kind of identified, like, this is the source, even I couldn't fix it at first, but even just the identification of the source, like, really helped me, start to have a mindset to move through it. Can't get rid of it, but I can move through it because I know you're there and you're not hiding from it anymore. What about you?
That's definitely important. So once again, we are totally different, right? It's like when I was like in high school. So, when you're a junior in high school, thinking about where you're going to go to school, taking the ACT, doing your applications. And it was a stressful time because I was like, where do I want to go? And what do I want to do? Am I going to get scholarships? And so I would start getting these random headaches on a regular basis. And I never had headaches before. And so, of course, being the type A, not hypochondriac, but I kept having headaches like right in my temples. I went to the doctor. We did blood work, make sure my blood pressure was okay. Make sure all my electrolytes were fine. Everything was fine. And then I, was talking to him and he's like, what's going on in your life right now? And I told him and he's like, huh. Well, let's see. Of course, let's come up with some behavioral modifications as far as like ways for stress relief, because I think that stress is kind of causing these potential headaches. And so we did that. I started working out a little bit more, doing some meditation, things like that, and they started to decrease. And then once I got into school, they went away. So I first really example that I noticed and that the doctor pointed out to me with regards to stress is tension headaches because of stress. And so, that's a thing. It really is a thing. And of course, you worry about other things, but the stress can cause those type of, significant symptoms too.
Yeah. Yeah. It's serious,
It is. I was like, oh my God, am I about to stroke out at 17? Like, what is, what is going on with something? It's a stressful time. And then you stress out about bad, it makes it even worse. So yes, stress is bad. Identifying it is so important. So, so important.
Yeah.
Okay, so now that we know kind of signs, we know some of the labs we sometimes order, how can we actually fight chronic stress? So I was scrolling the other day on social media or something, and I saw something about a cortisol cocktail. So what exactly is that?
That's that TikTok striking again. I see the cortisol cocktail. I did see that. I made sure I looked into it for y'all. So, I'll give it a mini side eye because it's definitely not necessary. But, there's some maybe placebo effect in there. Maybe.
And what
So it's basically a juice cocktail, if you ask me. So there's no alcohol, but it's orange juice, coconut water, and salt. And then some people like to get fancy, and they like to add some cream of tartar, magnesium, or some ginger. And what it's supposed to do is to calm and balance your adrenal system, because adrenals is where your cortisol comes from. They're supposed to boost your energy and improve your stress. So how does coconut water, salt, and orange juice do that special? So first, give your side eye for that because I'm sure everybody's drank orange juice before and it was not magic. Okay. So what they're saying is that they're giving you, basically it's a hit of potassium, vitamin C, and along with some extra hydration. So yes, if you hydrate, your body will be less stressed out. Vitamin C is good, potassium's good, but the issue here is if you have, something like kidney disease or diabetes and you already have electrolyte imbalances, you don't want to flood your system with these things. Would be something that, like, if I happen to have some coconut water and some orange juice and some salt at home, I'd combine them. But otherwise, it's not something that I'm run out to get. And please don't think that you're going to drink this, 5 times a day and it's going to relieve your stress.
Yeah, I think that's important to know, right? It's definitely not a cure-all for a quick fix. And then it's also, like you mentioned, it's important that not everybody can do this. So for
Right.
your kidney patient for your diabetics, for patients with reflux. These things are not necessarily good. And if anything, they may stress your system more and cause other issues. So I think it's important, like that you mentioned, it's not a one size fits all approach. Number one,
Yeah,
we think this is kind of a little suspect anyways, but number two, it can be dangerous to a certain population. So just be mindful of
right,
what Dr. Deniece just said.
right. Yeah, and yeah,
So
and
because of that, so obviously that's not gonna work for everybody or work for anybody. But so, but we still got stress, right? Like I can't quit my job. I still got to pay these bills. But can you
that's
tell
right.
us, besides obviously the cortisol cocktail that we are still side eyeing, what are some real things that we actually can control that can help us?
Yeah. So, stress is going to be there whether you like it or not, but, you can change how you and your body react. That's what you can really do. You can't get rid of it, but you can identify it and start to recognize it is step 1, and then step 2 is knowing what to do and having your plan, okay? So, the big one, even though it might be difficult, is sleep, okay? Sleep lowers your cortisol, it improves your recovery. Sleep hygiene, put your phone down, turn the TV off. I tell all my patients, you need a sleep alarm. Just like you got to get up at certain time for for you to go to work, you need to go to bed at a certain time to ensure that you get your 7 hours. Okay. Your brain needs to rest. There's also, you can take, magnesium is not habit forming if you're having trouble sleeping. Melatonin can help with people, don't make it an everyday for the rest of your life thing. But, if you're having a difficult time sleeping for a little while, that's a good one. Next is water. You're going to hear me talk about water all the time. Water reduces the stress on your body system. It needs water. You are supposed to be 80%, and some of y'all walking around pee the color of, Lord knows what.
Dribble?
Orange. Right, looking orange. Okay, you need 2 liters of water a day. Whatever health problem you got, unless you have a really, really bad hypernatremia, you can drink 2 liters of water a day. Okay, aim for 3 if you have no problems, because that's just giving you that little extra. The secret I tell my patients: take your 16-ounce glass of water with you to bed and drink it every morning. Okay, you will reap benefits beyond your control. Even if you just take 5 days and get your water every day and see how much better you feel. Okay. Of course, there's meditation and breath work, works better for some people than other, but it does activate your parasympathetic system and help you find that happy place. There's this thing called 4-4-4 breathing. Inhale 4, hold it 4, exhale 4. Okay. So that 1, 2, 3, 4. I can't do it while talking, but
I was
whatever.
gonna say that's not quick. I think she made a little, a little longer.
Well, 4 in, 4 hold, 4 out, okay? YouTube, all that, right. It works for some people. Okay. I like a little joyful movement. I remember during COVID when I was so stressed, every day there was a bathroom dance party just for me. Just, stretching it out, dance the stress away, take about 10 minutes, do it before your shower, after your shower, right after work, wherever you can get it in, get that little joyful movement, walk up the stairs, walk, after school, that kind of thing. And then, watch what you eat, all that fatty food. So it's, ironic that stress food is like fat food and sugar and all that stuff, right? So, try to get the salad, make it a good one, but, try to eat better, and that'll kind of help you out too.
Yeah. Yeah, absolutely. So that's all really, really, really good information. So everybody, make sure you save this episode so you can come back later, reference it, and try to use some of these techniques in your own life. But I know some of you are giving us the side eye, like, what about my job or my kids or my older parents? But the fact is that there are some things you can't control, and you can't pour from an empty cup. And chronic stress can empty your cup quickly, more so than some other things that are actually causing, stress in the long term. So we get it. But your stress symptoms aren't just affecting you, family, job, etc. It's necessary to take time out for yourself to deal with your stress. It's not selfish, it's a necessity.
That's right. Couldn't have said it better myself.
So if you recognized yourself in 3 or more of those signs that we mentioned previously in the podcast, you don't need to overhaul your entire life. Let's be realistic and change everything tomorrow. But you do need to start somewhere with intention.
Right. And, just to be clear, you've been dealing for this for months. It's not going to go away in a matter of seconds. It's going to take time to learn your patterns, learn your happy places, learn what you're supposed to do for you to get better.
And that's what we say even with dermatology, right? Like nothing is fixed. Hair is not grown overnight. Skin is not clear overnight. It's about being intentional, starting somewhere, and then kind of consistently being persistent and consistent with what you start doing in your new steps.
That's right. That's
So,
right.
what are our doctor's orders, Dr. Deniece?
So, number one, definitely sleep. Get your rest. 7 hours of sleep a night. Fight for that. Okay. Fight for yourself. And hydration. Get you a water bottle, a pretty fancy one. Y'all gonna get tired of me talking about water. Okay. But drink it. It's good for you. And I would say reflect. You gotta be taking time to think about what's going on with your life, how you're feeling, even just 5 minutes really was running on a hamster wheel, burnt out for years. Like, dang, something's wrong, something's wrong. But when I finally sat down, that's when I could make, real changes and go on. And then
Mhm.
reset. Take your time. Once you figure out that this stress is a problem, you see these signs, take your time, do your happy thing. Do you go to the spa? Do you go to the movies? Do you dance? Do you meditate? Whatever it is that you do, make sure you start that, emergency backup system so you can get back on track.
So are there any red flags that we should watch out for, like as we're kind of going on this identifying stress and kind of starting to deal with the stress, chronic stress?
Yeah, I think the things to watch out for really are, clinical depression and anxiety. If you're depressed to the point where you can't get out of bed for real for days and you can't function and you feel like you're just not yourself and you can't be yourself, it's time to go talk to someone. Anytime that you're so thrown off your schedule or your, normal actions and you just can't get there, it's time to at least talk to someone to get the ball rolling to see like, hey, is this
Mhm.
something that I might need medication for? Some people are walking around with ADHD. Not everybody that says they are, and not everyone that's on road. But some of us are struggling out here. At times it gets tough. So,
Mhm.
you really need to see if this becomes a point where it is interfering with my ability to do the life that I'm supposed to, it's time to get checked out.
Absolutely. Those are,
Yeah.
once again, all good and valid points.
And then reiterate some of our bonus hair stress tips and things like that.
So once again, there is no magic cure as far as products, right? So let's not be product junkies. I know I'm definitely guilty of that when it comes to like trying to find a curl stuff that works, and I have boxes full of stuff. But when it comes to hair growth, not every myth or trend that you see is accurate. So make sure you do your due diligence, see your dermatologist, talk to your primary doctor about running labs just to make sure there's no underlying issue that's causing some of the hair thinning or shedding. Also, be mindful of your stress. If you are starting to notice, that stress is in your life, try to start finding little ways that you can kind of help to improve or work through that, because you will notice a difference in your hair growth as well, and potentially your skin. And then once again, say no to biotin supplements.
Getting on that bias head. Yes, I think those are excellent pieces of advice. And definitely, avoid them TikTok trends. Okay. Yeah.
You can
And
be
so,
loud and you can be loud and wrong. And that is a lot of TikTok. So just be mindful who choose to use for your medical advice. As I mentioned, we mentioned earlier, like doctors have credentials for a reason, right? We didn't just get our knowledge overnight. Most of us did a minimum of 12 plus years of school. So it's been a long time. And it's not
mhm,
that's why medicine is what it is because the body is so complicated.
right.
And the crazy part is, or what medicine is we can make it look easy, but that's because of the 12 years of school. And so it's not just about what you're seeing, it's all the intricacies and kind of the minutia that you don't know about. Is how we're able to explain it to you, and also potentially if something goes wrong, we know kind of why it's going wrong and what to do to fix it. So just be mindful of that.
Right. And we want you to know you got new besties now. So if you see any TikTok
Pretty
trends
much.
or any mints,
Pretty
you need
much.
any myths that you wondering, is that what it is? You just write us a comment, you email us, let us know. And, we'll go ahead
Yep.
and knock that out for you.
And adjust it for sure. For sure.
Yes. All right, ladies, if today's episode resonated with you, we want to help. Like I said, drop any questions you have in the comment and we'll make sure that we address them in future episodes.
Absolutely, absolutely. So if you're dealing with stress-related skin or hair changes, you don't have to suffer in silence. Sometimes a professional evaluation by a board-certified dermatologist can give you answers that you've been looking for a long time.
Yes. So follow us on Instagram and Facebook. We're at Symptoms and Side Eyes. And share this episode with someone who needs to hear that their symptoms aren't all in their head.
Exactly. So we'll give you a little preview for our next episode. So we're going to dive into the hottest topic in the medical world right now, and that is those good old weight loss shots or GLP-1s.
Yes, yes, yes. You do not want to miss this one because I'm going to tell you how they work, what side effects to watch for, and just how to deal and how to approach being on those medications. Okay, this is hot stuff.
And then we're also going to introduce a little side note called CEO's Side Note. So it's a real talk about building medical practices and side businesses that actually listen, and medical practices that listen to women and side businesses, right? Because we're entrepreneurs and we have that in our thing too. So we want to kind of share some of those tips with you as well.
Awesome. All right, so take care of your mind, body, and edges, and we will see you next week.
Absolutely. See y'all next time.